I'd like to welcome everybody to the March 3rd Audit of Claims meeting. Thank you very much for coming. Kyle won't be here tonight, but I put a couple things in your box. One of them was the local law creating Article 3 of the Chapter 164 Code of the Town of Webb prohibiting harassment and or feeding of wild animals. This was given to you last month, but they added the word harassment in it. Our chief of police has taken a look at this. He'll help support this new law. And
Enforce too, you're saying too.
so we'll have to, what's that?
Enforce too.
Yes, enforce and, yes. And he read it over and thought it looked good, so we'll talk about going to a public hearing on Tuesday for that. But I wanted you to know that it had a new word in it.
Okay.
And then also, I put a note in your box about medical insurance for retirees. I'd like you to look at that. Maybe revise that for the next meeting as well.
This is the latest version, right, Nancy?
The harassment,
This is
the one
yeah.
I just gave you
Yep.
is the latest, correct?
Is it
That is
third,
the
right?
one and only.
Okay, I'll check that out some more.
Mike, you wanted to talk about McCauley Mountain chairs.
Yes, I do if we can. So you guys, at that last meeting, I said, please write down some things that your thoughts. And I don't know if anybody wants to go first or you want me to, but I would like to try to figure
ahead.
out what we're doing with all these chairs.
All right, I have Kyle's letter if you want me to read that first.
Sure.
Start it off.
Yep.
As far as the McCauley Mountain chairs go, I believe we should hold at least 20 to 25 chairs to repurpose throughout the town for dedication. And raffle or auction the rest. I do like the idea of setting up a raffle for the chairs. $25 or $50 per ticket, with $200 per chair being sold. If all the tickets are sold, each remaining chair, that would bring in $300,000 to $320,000, or $600,000 to $640,000, based on the raffling of 60 or 64 chairs. The money could be quickly turned around for the install and expansion of the carpet going in, and add some money for future upgrades of the mountain. Just his thoughts.
I think he's asking, or I don't know, I think we're gonna get that kind of money for him, but. It's a nice
You wanna
thought.
go in order here and go to Ben?
Yeah,
Kyle's done.
Yeah, well, I mean, I think it's a good idea. I don't think that we're gonna probably sell 200 raffle tickets per chair to come up with that kind of money.
I don't either.
But I do think that it would be a good way of doing it.
so
As far as selling off tickets.
200 is too many, so maybe 100 or lower that amount
Yeah, lower the number
per chair.
per chair.
My turn?
Yeah,
Kevin's here. I just wanted to, I have a thought or two on it, but do you have anything
why
that,
don't we go first and then we'll talk to Kevin?
Because Kevin's gonna help us out big time probably.
Yeah,
well, my thoughts, I think were gonna be based on what his thoughts were.
oh, all right.
Is that okay?
Yeah, go ahead, Kevin.
Yeah. Do you got,
Yeah, so I'd like to keep 5 of them at McCauley Mountain. Spread them out throughout the property, a couple on the deck, a couple at the top in good viewing areas, maybe one out by our sign. 10 of them out in town and wherever, Point Park, North Street, Lakefront. I think one would be really nice by the Toby bike path, the bridge, there's a bench there already. I think a old halt there would be nice there. I like the raffle idea. I think selling tickets, maybe $20 a ticket for the chance to buy the chair at a set price. The set price I had in my head would be $500 to $550 per chair. And That's about it. They're currently under about 5 feet of snow, so won't be able to really do much with them until spring, but
Right.
I like us having a plan in motion for when the time comes.
Right, that's what I'm trying to move on here.
Okay.
So they're pretty weatherproof, right? So having them across town, they could stay wherever they were.
Yeah, making
Most
benches
part,
out of them and things.
yeah. So I like throwing it, and there's 60 total.
84 chairs.
84.
84. So like definitely, throwing a couple across town over here, wherever, I think would be fantastic. Obviously,
on the new deck at Macaulay, we need some.
yeah, I think we come to an agreement on what Macaulay wants to keep, right? So like how many you guys would want to keep? If we all come to a number with that, that'd be great.
Well, he said, he just mentioned 5. I had 3 down and then asked Kevin if he needed any more, so pretty close.
So we talk about honoring that probably together when Kyle's here to put in his 2 cents, but yeah, I'm definitely for that. I would be careful with the raffle because if somebody goes by, that sounds like fun. I'll throw my name in that for $20 or $50 or something. Then all of a sudden they win it, and boy, I'm always in a bunch of raffles. What happens is this chair now, and this chair ends up sitting in somebody's backyard. So I think there's going to be a huge desire for the others, let's say 50 to 60 chairs that
There's
are
going
going
to
to
be
be
a
there.
huge desire.
So what you can do
From
is
what I
like a lottery kind of is more different, is a little different than a raffle. A lottery is something that people all put their name in order to be eligible to buy the chair. It's kind of going off of what Kevin's saying. So I think that would be, instead of having this big old thing and people being kind of left out, a lottery is just a really fair way to give 50 people an opportunity to buy those chairs. If they don't want to be in that lottery, then they don't care to have a chair and they wouldn't buy one. But if you do a raffle, I think you're just going to get a little careless with them, is my thing. And then you can pay to be in that lottery. And if your number doesn't get called, then your number just doesn't. Or you leave that part out and everybody's name is in the lottery, and you just, where they got that big wheel crank thing at the CA down there. You know what I'm talking about, right?
Yeah,
Toss them
it's-
on Mike Ross.
Lottery's the same thing as somewhat of a raffle, just different wording.
My biggest thing was trying to open them up to our community first.
Right.
Yeah.
We're putting them on an auction site so that some guy in
Yeah.
Wyoming or someplace that doesn't have anything to do with Old Forge or Macaulay buys them up.
That's what so the lottery would make it, you could make it as specific as you want it to be.
Right.
Yeah.
For seasons pass holders and residents of
Exactly.
the community
Yep.
is what I would.
Those.
I think that sounds like it gets things complicated, but it's a way to deal with it. Trying to deal with all that is gonna be a little bit of work.
Well, you'd sell a certain amount, right? Or put out a certain amount. Maybe somebody could get a link going that would take all the information in on these people.
For
with
New
a
York
lottery.
State, you can't label season pass holder and residents only, just,
Oh.
once
yeah,
you open
probably,
it up,
yeah.
you're opening it up, you're not gonna be able to distinguish, okay, you're not a resident, or you're not a skier, you can't do that.
So to make it, to go down that local route, you could, like all that great stuff you guys are throwing up there now, these events and stuff like that, you could make it in person. Just put one chair up there and say, we're gonna have our in-person auction for however many you're getting rid of.
Well, this could take years to.
It just
do
depends on
this.
how
I mean,
far you wanna do it.
He wants to
that's
get rid of
all.
these things.
Yeah. Yeah, but I mean, it's important,
No, I totally, that's why we're talking about this, but
and that's just my thing.
Ben, what are you thinking?
Yeah, I mean, I think we should go that route on that and just, set a date, you can start doing the lottery now or within the next month or so, and then set a date for sometime in the summer to have an event that you have to be there in person,
Yep.
have
It'd be
it.
pretty cool. It'd be pretty fun. You don't have much going on in the summer up there, right? For events and stuff like that? Like events, I'm saying. Nothing right now though, right?
Correct.
Yeah. No, I just mean events. I know they're working.
Yeah.
You're saying events.
We could get, that could. Alright.
Well, I had to definitely have a couple things. My first thing was, I think Stevie Eustavinus should have a chair. That's my 2 cents. If you guys don't agree, that's fine, but I think
Me too, I'm with you.
he's done this thing, he's been up there for most of his life.
How about Dave Kress if you want us one too?
I'm just putting his name personally, it's my turn. I said 3 chairs for McCully, but I'm perfectly fine with 5. Cause part of my notes were also to ask Kevin if any more were needed after 3. I had one down for Point Park property. I had question marks by lakefront, if you guys wanted to put some on the lakefront. I just had sell the remaining chair, well, also there was this kinda came up, and I don't know if this works or not, but a couple of chairs, I don't know how you guys felt about possibly donating, if they wanted, to a couple of business like the Blue Mountain Museum, the Wildlife Center, or the Northern Loggers. I don't know if they would have an interest in having one of those chairs. It would be up to them, but that's only 3 chairs that I came up with. Places like that, they're kind of people that,
These are all good ideas.
and I wasn't doing raffles or nothing. I was just selling the remaining chairs for $550 a piece and get rid of them. But that was just me.
Okay. Well, we got a lot of good ideas. So we'll have to, what's that? We're not making a decision right now. We gotta think about that.
Well,
We'll think about that. We'll get with our mountain manager over here.
Yeah.
Well, and I think the ones that we do keep, we should keep the ones, like the year that, Hank went to the Olympics and Louis went to the Olympics, keep those ones and have those ones, with their name on it.
well, that, and that's
Yeah.
that's a good thought,
Dedications.
because yes, that was brought up in conversation that the ones we put around town could say a name on it versus giving that family or that person a chair. Put it out front with their name.
I said keep 20 for town of Webb seating and dedication. So that would leave 64 chairs. And that would include Stevie Eustavinus' chair somewhere in town, not giving one to a personal property.
Right.
So that was my thought, just because there's an awful lot of people that put an awful lot of time up into McCauley.
Yep.
And so to give just someone a chair, I think we're gonna get in trouble that way. So I thought that doing 20 for dedications was. And of course, I like that Auctions International idea, cause it's all, but we'll do it the harder way.
Well, it is gonna, I don't know who wants to try to think of how to do that, but that's, I don't know.
I will.
Okay, good. Because that is, if you do it in an event, I get it. It probably will, things will work quickly.
Yeah.
But you only have so many events and so many people at the events. So that you're gonna have, time in there to say, all right, now what are we gonna do? After we just got rid of whatever, 30 or 10 or whatever. How do you
Have a
go to the
soda
next
pop.
thing?
They go for a bike ride or something. There's a bunch of bike trails up there. Look at the leaves. Ride the
I
new
don't
chairlift.
have anything.
You're good with that, Kevin? That gets him thinking though on what we were thinking anyways.
Yeah, it gives you our ideas at least.
So if you think of what Bonnie just said, 20, it's whatever, 20 to 25, basically take off the list, so that's what you got to work with, right? 60, somewhere around 60 something chairs.
Who was it? You and Kyle are up at the mountain with Kevin. You guys are that department.
Well, yeah.
Maybe you guys, talk with Bonnie and whoever, come up with a nice little.
Come up with the plan.
Sure, that sounds,
Okay.
and we'll vote on it.
Ben, did you get the link to the ECA meeting for?
Yeah, I got that. So I should be all set.
I'm gonna pat myself on the back.
I know, good job, I'm impressed.
Thanks for that.
For the Zoom meeting tomorrow, you're talking
Damn it,
about.
you said, can you send me a link? I'm
You
like,
okay, Kevin?
thank you.
Hey, Kevin,
Take care, Kevin.
Kyle and I will
Before
be
you
in
make
touch.
too many plans, call me about the raffle, about
Yes.
the lotteries.
Okay. All right. Have a nice night.
See ya.
Thank you.
Keep up the good work, pal.
Yeah. There's laws to lotteries and raffles we have to follow.
Yeah.
So we have to make sure she's got it all straight before we are doing something we shouldn't do.
Right. Well, can we even just sell them outright? I don't even know that, can we?
Yeah, that,
Yeah, we already established that part.
Yeah.
you can't make it that the winner can't be, the winner, New York State doesn't allow you to say you, am I wording this right? That you cannot be there to win. You can't do that when you sell lottery tickets.
Oh.
CA used to do that with snowmobiles, you had to be there to win, and you can't do that. That's why
Yeah.
you guys don't do that anymore. If you buy a ticket, everyone's equal. So you can't make it that you're gonna have an event and
You have
Linda
to
just
be
bought
there.
all these tickets and now she can't win because she's not gonna be there. You can't legally do that.
I don't believe you can flat out just tell somebody, you're eligible to buy one of these, but you're not. I
So
don't think.
there's.
Yeah, I
I'll
don't
talk
think
to
that
Ken.
either.
So that's why the lottery,
Yeah, I'll talk to
lotteries
Ken,
are
but-
different.
Right, right.
But
So we
I
gotta be
could,
really careful when we do it, that's all. That's all I'm trying to, that's all I'm trying to say. You gotta be careful.
did we, with the snowmobile permits for Snowfest and stuff, is that gonna be held off for next year? Is that a little touchy right now? They're gonna have them
For next, yeah, no, they're selling early tickets.
they're gonna be selling early tickets
Oh, yeah,
at Snowfest?
going right ahead, yep.
Okay.
Yep, I just talked to Alexis today about that. $80 tickets right now for
Right,
the
for-
rest for
for-
this year and next year.
Right.
So then the year by year agreement thing then will be just, that'll just get hashed out and talked about either way.
Yeah, when they're,
Yeah. I keep forgetting you guys reach out to Dan.
Okay.
it didn't seem like there were gonna be any changes, so.
Sweet. Great news.
And so far this year, it was all good.
Yeah, it sounded like when Herb was here, all they cared about is trying to upgrade some of the stuff, which had nothing to do with the agreement. I guess,
We had snow.
yeah,
We had
huge
snow.
difference.
The refund?
Oh, refund? For,
I sent that email from,
hang on, that's right here, sorry, it's on the second page. Mr. Durr's requesting a refund for the boundary line adjustment. And I have a note from Kyle, as far as the refund goes on the planning board application fee, I was always under the understanding that these fees are non-refundable. I do not understand that I do understand that at times if somebody backed out of a project, they were not charged at the time, but time they were ready to proceed. So when Andy walked out the other day, I thought that's what we agreed on, was that if he decided to reapply, that he wouldn't get charged, but we've never really given application refunds. So, it's up to you guys.
I think I replied, said the guy was gonna do it and then something came up and he couldn't do it, so I didn't have a problem refunding him, I mean, paying for something he didn't do.
But if there was any filing or work done in
right
the
there.
office for it, then it
There was no advertising or anything, it was just office work.
was the office work.
Nothing was advertised, they didn't make packets, they didn't do any of the normal stuff they do with it. So no, nothing was done.
So again, I'll say, I didn't have a problem with the refund, but
Right.
whatever else anybody gets voted down, it goes down.
Now it's just, what do you guys wanna do? Refund or not?
How much was the amount?
$150, I believe. Say 150.
A couple days on that, was till Tuesday?
Refunding or not? What do you wanna do?
I just haven't looked into it at all.
I mean,
Well, they
if
can do it
there's
on
no
text.
time for them working on it or doing anything with it, then
You can leave it, it's fine, it's just-
Yeah, the refund's fine with me.
if they had to work on it, then
$150.
So Tom Durr's letter said, due to unforeseen issues with the redrawing of our property line, it will either be canceled or at least need to be redrawn, therefore we will not be ready for any planning meeting in the near future. Could you please put in the process the steps needed to refund my application?
And the problem is we don't, when's the last time we've done something of the sort? Is
I
that-
have no idea.
We don't know.
I don't think we ever have.
If it works out so that he ends up doing this, he's gonna have to pay to do it anyways, so.
I'm fine to
Okay,
send it back.
Yeah.
Yeah, you can refund.
So we're refunding?
yes.
Perfect. Thank you.
Sorry, Nancy.
That was easy. It was.
What are you looking at me for? Oh, cause the bills?
No,
I'm going.
There's a few of them there.
Yeah, I'm going. I got another stack for you too.
There's a couple of good ones in there, finishing up McCully, hopefully that's the end.
I saw that.
Like Bonnie and Nancy both said that hopefully after that we'll be able to have a tally of how we made out there.
Yeah.
All good.
Trainings.
Yeah, the only thing left is the decking at the top to get off the chairlift for walkers, you know. Not
summertime.
skiers, right now it's just ski access.
Yeah.
So it'll be whatever that lumber is.
And do you wanna, this insurance thing, do you wanna say anything about that, or?
No, we'll just wait.
Okay.
Do it Tuesday. So everybody has a chance to look at it.
Right, okay, Tuesday's good. Let's see if I had any other goodies.
Those doors they look pretty, I saw a picture. I didn't get a chance to get down
I
there.
haven't gotten
I was
that.
over there, they're nice,
For the rec center.
they're nice.
And that was Grant, right?
Yep.
Yep, that all.
That's awesome.
The doors. Chuck has had some good breakdowns on some groomers. He's got a hydraulic pump that went that's gonna be real expensive,
Okay.
and a bunch of other little things, but that was the big one.
They've been running.
Casey had a bad day too.
Yeah, Casey's got some,
He got one of the trucks got broken down up past Stillwater. Hydraulics went out on it. And then another one clipped like one of the ice banks and broke the blade. Jimmy's Bobcat, we have to rent one because that one's gave
I
out.
saw that. He's in a different machine now.
So our equipment's getting hit hard right now.
well, it's been used a lot.
Yes, it is.
Yeah.
As far as Snowfest, you guys, right now, the plan is to have the jumper out on the soccer field.
I saw him chucking, or Chuck grooming there.
He's been flattening that out,
Yeah.
because we have plenty of snow, and it's not gonna affect anything with the field. And we won't be taking snow out there from the roads and stuff, it's just, because they have all their ramps and everything are all self-contained, they aren't snow, it's
They have their own ramps. It's not snow ramps.
not a snow ramp. It's a wooden ramp they go off of, and then they land on this big, huge balloon bag, big blown up thing.
Well, that sure helps when there's no snow.
Yeah. Well, it helps us, because we used to have to
I
make
didn't know
those.
that.
I didn't know that either.
Is this the first year?
No.
No, they've been doing
They
it.
did it that way? No?
No, they did it last year. Say it this way.
Very
It
interesting.
makes it extremely more complicated for basically me and Dale Haru to try to figure this all out, because getting out on the field is gonna be a pain. But figure it out.
You guys always do. Thank you.
The problem is that them guys, they don't come in till late Friday night. The show was 1 o'clock on Saturday, so we have that short period of time to get it set up, and then the show lasts about an hour and a half and it's all done.
Health center stuff. I saw the most recent health center stuff is all
Yeah, yeah,
seems to be coming back together.
yep. He said today or tomorrow they should finish.
I wouldn't mind speaking to the health center.
Okay.
A lot of patients have been asking us what happened, what's going on, there's a lot of misinformation out there, or actually, I think inaccuracies. At the beginning, NVHS concocted this because they wanted to buy the building for a cheaper price. NVHS has never made a decision to make an offer into the building. It had nothing to do with that. And then the next thing was that there was only one person that felt there was a problem. So I just thought I would go through the process. And then if anybody had any questions from the health center's perspective, I'd be happy to answer them. So basically last November, December, 3 people from the health center became ill. These people are part-time, so it became easy to tie it to 2 to 3 hours after starting to work in the building. It was discussed amongst staff and the people that had symptoms, and was brought to the administration of NVHS, who took it to the facilities manager and requested that the town do some testing for mold. Town agreed to do the testing. That was done in early January. January 17th, the town received the report of the mold testing, which did show mold. I know that's another thing that's been stated over and over. There's no mold problem. But the initial report did show high levels of 2 specific types of molds that are highly toxic, Aspergillus and Stachybotrys, which is known as black mold. And these particular molds were found in high levels in the basement, and Aspergillus was in the office as well. These particular molds secrete toxins called mycotoxins, which are dangerous to human health. They are released by the mold to kill other molds if they are invading the territory. They are very tiny, they float in the air currents. You don't need an air directing it somewhere. If it's in the basement, the mycotoxins are in the building. The levels in the building were much higher than the levels outside, which you normally in a building, especially a facility like a healthcare center, levels of mold are much, much lower than the outside. These were much, much higher, indicating that there was a problem in the building. Remediation was recommended by this company. The town did second testing, which showed different numbers, but essentially remediation was also recommended by the second company. So January 17th, the report was received by the town. February 3rd, I requested the results, thinking they were probably benign, because it had been a long time since we heard anything, and I was told then that I would get the results when the second set of tests was in. But these people were salesmen, and they had no, they weren't to be trusted, basically. So that report came. It was sent off the line to administration on the 4th of February because our chief operating officer, Dr. McCates, was coming to visit the clinic. It went up the line. He reviewed it the morning of February 5th. The CEO of the hospital, the COO, and the CMO, the Chief Medical Officer, Dr. Zimmer, all met with infection control, the Director of Infection Control, and a critical care pulmonologist. They reviewed all the results, and they made the very difficult decision to close the office here. That was made on February 5th. And the office was closed. It became known in the community the second we started calling for us to move into Boonville. The afternoon of the 5th, the town met with Dr. McCates, the facilities manager, myself, our office manager, and Nancy and Bonnie. And the facilities manager indicated it doesn't matter really what the second company shows. We have this report, the Department of Health, who inspects hospitals and medical centers that are run by hospitals every year. And that report would make them shut us down if we didn't respond to it. So they did advise the town that they would not be able to move the medical center, the employees, and to work out of the medical center again until remediation was done. The town agreed to do remediation at that meeting. On February 11th, the last board meeting, we were all told that a company was going to be doing remediation, and we didn't have a start date yet. It would take 1 to 2 days, well, maybe 3 to 4 days, but basically we'll let you know when we have a start date. So 2 days later, I sent that offline so that our hospital would know we have a company, they're gonna start remediation, we don't have a date yet. 2 days later, the facilities manager called the town to find the name of the company and when remediation would start. He was told there was a meeting that afternoon and papers would be signed and remediation would start. That was on the 13th of February. Nothing after that until February 21st, when an email was sent saying, we've checked with other sources, remediation is not necessary, we are not doing remediation, and this is why. And the wells will be wiped down with soap and water. Well, I think it was already made very clear the medical center would not open again for patient care until the building was cleaned. And MBHS immediately made the decision to take that cost on and start remediation. That was the 21st of February, which is a Friday. It started Tuesday, the 25th, and remediation has been going on since then. It has taken longer because the basement had wet boxes and papers that the remediation people had to remove in order to clean out the basement and then get rid of the mold. After the remediation is completed, it will be retested by a separate company, and then when the testing shows that the mold has been removed, we will be able to move back in. And I think, other agencies were contacted. I spoke to Todd Crawford from the Bureau of Toxic Substances, who said, well, first of all, the Bureau deals with pesticides, PFOS, heavy metal toxicity, and they do research, they set standards for those things. He says when we get a complaint about mold, we don't worry about mold. I don't worry about mold, I don't care about mold. If there's a complaint of mold, we worry about the building. If the building needs to be remediated for business to come back in, that's one thing, go ahead and remediate, but the problem is the building, which I certainly agree with, because the problem will just come back. So long-term, the building's a problem. He doesn't care about mold, he doesn't study mold, he doesn't treat mold or mold toxicity. And very lovely guy, we had a great conversation, but it wasn't really relevant to our situation. The OSHA site, has a bulletin on mold, and in that they say there's no minimum standards for mold because if mold is found in a building, it needs to be removed. They talk about how it should be remediated later on, but they basically say it's the owner of the building's responsibility to remove any mold and to make sure that the environment is safe. And if there's people who have become ill, potentially from the exposure to mold, that healthcare professionals should be involved. Now, our hospital did involve healthcare professionals, the infection control, critical care pulmonologist, other doctors, and they made the decision that remediation was needed. So basically, the end result that the town has refused to do remediation, which was absolutely necessary to bring back healthcare to this community. It's been a full month that we have not been able to serve the community at great expense to MBHS. Hours are 11 hours a day with the drive to Boonville and back and taking care of patients. Patients have had to drive to Boonville for their care. Many of them have canceled. MBHS paid for overtime for travel and canceled appointments. It's a huge expense to them. And now they did a very extensive remediation to make the building safe. And I think the one thing that's lost in the discussion, that's the verbal discussion, the written discussion out there, is that this is a healthcare facility. This is a medical establishment. We are guided by strict Department of Health environment guidelines. If they come and even have a box on the floor, we're cited. If we deviate from what they consider a safe environment at all, we're cited, we can be closed, and it's a very bad outcome for the hospital. The other fact about it is there's 3 people in the building who have been sick, who are staff, and we take care of vulnerable people. We take care of people with immune deficiencies, with COPD, with children with asthma, autoimmune conditions, people on chemo, with cancer. We can't bring them into an environment that we have evidence is not a safe environment. And whether people believe in mold and mycotoxins is totally irrelevant. And I can testify that mycotoxin toxicity is real. My staff have all seen how sick people can get with it, which is why they are extremely grateful that we have an employer that was thoughtful enough to remove us from the environment. And despite the difficulties over the last month, they're grateful to go back to a clean building. And there is not just one person who thinks it was a problem. There's an entire hospital, executive level staff, all of the employees and the patients have been extremely supportive of what we're doing. And I don't think that we could do anything less. But I think it's been a disappointing experience in the relationships that we have tried to foster, a very positive relationship with the town. This has been a little devastating, I think, for everybody dealing with the situation. And, one of the reasons I wanted to speak to it tonight is because if people have questions, I'm available. If people think other agencies have more or better information, I'd like to know about that. I think that I contacted the people that the town supposedly had contacted. And how you interpret what's being said is important. But we are a healthcare facility. We take care of sick people. We got 3 sick staff. We couldn't do anything other than remediate, which is not our responsibility. It's the responsibility of the town who owns the building. So I'll be at the next board meeting if other people have questions from today's discussion.
Thank you. Do you guys have any
I'm sure there'll
questions?
be questions. Well, how do I even say this? Obviously, we 100% care about healthcare. There's no doubt that I don't think any of us said, "Oh, the heck with it, don't worry about it." We took it very serious. I know that there was calls and trying to find out a lot of this information. I can tell you, I personally heard that there was only one person that was sick, and everybody else was asked if they were sick, and it was only one person.
Well, that's not true.
That's just what I'm, you had your speech, I'm just telling you what
Okay,
I
I'm
knew.
sorry.
I'm just telling you what I knew. I had heard, and I wasn't a part of every part of this, but the parts that I had been a part of, the health department guy, I was in the meeting with that guy, he didn't seem like that there was a big issue. Not that we weren't concerned about it and gonna take care of it and get it cleaned and all the things that we thought we needed to do, but it wasn't this, holy cow, you have to shut down and this is the end of the world thing. I do say that things came together really rapidly and all of a sudden, everybody was getting a call saying, you gotta go to Boonville. It did spark a lot of attention.
Well, we were rescheduling people because they closed the building.
Correct.
Yes.
So it
Yeah.
had a press release, was discussed at the meeting that we had, so the morning of February 5th, the decision was made to close the practice and move to Boonville. All patients starting at noon. The afternoon when we all met, there was a press release, it was read to us when we were standing there, and Bonnie agreed to put her phone number in the press release, it went out on Facebook and went out to the news.
It didn't come to our office
Well, it did, but I don't know where
No, it
the
didn't.
email went, but it did.
because we kept asking
We asked
for
for
it.
a lot
It
of
was all over
that
Facebook.
information from all the different studies and all
And
this.
it was
We asked-
embarrassing that we weren't able to put it out, and it was at Living 80K before
Well,
we
you
got
could have
it.
done a press release yourself even, I mean, it
We were
doesn't.
waiting for it to come from MVHS in the words. We weren't gonna put it.
In the room, but anyway, I
Yeah, that's the
think
problem,
that's
is everybody
it.
heard things, and nothing's in writing, everybody heard it.
Right, and we heard for 2 weeks that remediation was gonna be done.
Mm-hmm.
We heard.
And then we kept looking into Todd Crawford, who said, and he did not say he doesn't care about mold.
Yes, he did, to me.
Okay,
I had a
well, he
very
didn't say
long
that to
conversation with
us.
him, and mold is not an issue, I don't really care about mold, and I go head to head with many people about this whole
Right.
discussion about mold. They don't do research on mold or mycotoxins, he doesn't treat people with mold or mycotoxin injury, and he doesn't, his opinion is the building is the problem, and I agree with him, the building is the problem. But we have to, as a health center, we have to move back in a healthy environment for our.
Oh, I agree, and I'm grateful that everything's working out right
Well,
now.
it's not working out well for the relationship, that's a problem, and I think that we want to fix that. We need to fix that, but
Yeah, and Ben's been talking about that, have you not?
I have.
About fixing the relationship with MVHS.
How?
Well, direct to some board members.
I'm sorry?
Directly to some board members of MVHS. So I have.
I mean,
And working on that.
I'm not here to say
So,
we are, first of all, the executive of the hospital is very committed to this community. they will remain very committed to this community. They will work with whoever's in this community on board with them. But it has soured a lot. And it's through the process of not sharing information from the 13th of February till the 21st, which was an opportunity for us to start remediation. If you weren't gonna do it, say so. We would have been in 2 weeks ago. And the expense of the last 2 weeks is huge. And I think that, I mean, in the end, we're gonna have a cleaner building. I don't know for how long, because I don't know what that is gonna look like after the fact. But I think that we will be grateful for it. Anybody who works there is, and the patients are. But I think that it was a process of, you know, if the town did not want to do remediation, they shouldn't have said, yes, we'll do it. Yes, we'll do it. Yes, we're signing today. And then
When we talked to Todd Crawford, we were gonna do what his remediation was and what he asked us to do. And then that's when Dr. Libby said they were gonna do it themselves, so.
right, because
Right, we
it was
weren't
on the
moving fast
21st of
enough.
February when
Right.
we had been told on the 5th, the 11th, and the 13th that it was all being
Yeah,
done.
well, we apologize for that. We were compiling information left and right for
Why
this.
didn't you have an open discussion with the hospital then? There was nothing, there was just, we're doing it. You know, I think that the way it was handled, obviously, I don't think was a very good way of doing it, being scared off probably by the cost of it, which I think is probably extensive. I have no idea, but I know that nobody wants to do mold remediation because it's very expensive. Town doesn't have money for it, NVHS doesn't have money for it, but on top of that, they've had to incur a month's worth of other expenses, which could have been much shorter had the town and NVHS just sat down and said, okay, we don't have money, we're not gonna do it. Well, we don't have money, well, let's figure out how we can do it. We could have enlisted the Health and Wellness Fund, we could have worked a little more proactively together. And I believe that, and I want to be able to work proactively with the town. We want to provide good healthcare here, and we do provide good healthcare. We still want to make plans to expand our healthcare here. We don't want an adversarial relationship. But I think that everybody should know that this was difficult.
Well, and I don't ever remember it being, a question that we're not gonna take care of it. I don't know why why they thought we weren't paying attention and why, I just don't know why there was a problem there.
Well,
We-
letter
As far
went
as I know, from understanding everything that I understand, and again, I'm not sitting at that office every day, I'm not down and talking to the hospital people every day. I'm not doing all that, but what I understood, being just a board member, it was slowly being taken care of. It couldn't happen overnight. There was, people came in to test it. What I heard was the first guys that went in there said there really isn't a big deal here. There wasn't water in the basement from what I heard. I haven't been over there to walk around because I stayed away from it. There was no moisture down there. That's what I heard. It was dry as a bone down there.
Okay, there was no cooling water, but there was moisture everywhere and all mold.
Okay.
Okay.
That, I didn't hear that. I heard that it was dry as a bone down there. These are the things that I heard. Whether or not who else heard that, I don't know, but
A backed up sewer several times probably left a little moisture down there, as well as some other lovely things, so.
maybe.
I mean,
Maybe
there's
it did.
definitely source and reason to be concerned about.
Some of these things that you're bringing up right now in front of us, some of these things not everybody knew, and these are the things that don't get spoken of. And that's why this little bit of a situation obviously happened.
Right, which is why talking would have helped a
Sure,
lot.
sure.
But I think that moving forward, the town needs to take care of that building. The building, the wheelchair ramp has been crumbling for a couple of years.
That's on the
never
list.
built with
It's on the
open
list.
Windows that almost take your arms off when you try to open or close them. The air and cooling system is totally inadequate. You're either freezing or you're boiling. And all of those things have been brought to your attention, and none of them have been corrected. So if we have a situation, those particular molds are highly, highly toxic. They release substances that make people very, very sick. And in a way that regular physicians don't know what to do with these people.
That's why I don't understand why we were told that wasn't the case. So
By
I'm
several
lost
different,
here.
by several different,
You know what I'm saying? Is
So it's
you're
hard
saying
to-
that, but we're here, we were told that it wasn't, so it kind of puts us in a balancing
I'm
beam
No, it
here.
wasn't.
saying those things because it was. I've always.
Not gonna call you a liar, I'm just saying that we were told different, so we're kinda sitting here on a
So
razor
maybe we
blade
can
saying,
just
what do
learn
we
from all
do?
this. Maybe we can just learn from all this and get all
Yeah.
this stuff on paper and figure
Yeah.
out what the maybe make
Got
a
a relationship
make a
going,
priority
like we
list over
said.
there with what needs to be done and
Yep.
get all this snow melted and figure it out.
I just wanted to bring up a couple of things. So I order the supplies for like the last 2.5 years, so I do have to go down in the basement sometime, and it's really bad down there. You walk to the right, and there's a table, and it's like this thick drainage of, here's the nursing part of me, drainage, thick, watery stuff on the table. And there was some instruments there that were outdated, that they leaked down, so we sent them to be autoclaved. I don't know who, then it looked like somebody unloaded an apartment in the middle part of it. I mean, I didn't go over that part, I just had a small area. I was kind of feeling guilty because I thought, geez, maybe I should have spoke up a little more about this basement, because it's really bad. Then one day there was a leak coming from the ceiling, and we called, and it was the toilet. So the toilet up in the main office was leaking, they changed that. But I don't think a lot of people realize, and I think it's gonna kind of come out a little bit. I think more people are probably gonna ask to be tested, because I don't think the people that work in the office actually know a lot about what mold can do to you. I've just learned actually the last probably 10 years with Dr. Perlansky and a couple of people I know personally that were affected, but I think people are gonna start thinking about it too, and thinking, oh, this is probably why I didn't feel well. So, I get
Thank you.
Very, very sick with mold and mycotoxins.
Thank you. Yes, Linda?
May I just think it's important as we're having this discussion to remember, you know, that there is a line from MVHS that the building is insufficient and inadequate. And, you know, Dr. Polanski, as well as being a fine physician, is also an administrator through MVHS. And that's important to just acknowledge whose roles are what and what roles people play. The other thing is I have looked through the lease, and it is very up for debate about which parts the town is most definitely responsible for the wheelchair ramp and the things on the outside, but the cleaning portion and the things like that, it does look to me as though the health provider, the lessee, is responsible for those things,
Not the
so.
basement. We don't rent the basement.
No one's supposed to be in the, you're not even supposed to be in the basement at all.
The basement is.
No one's supposed to be in the basement. I don't know why you have supplies
We
down
did put
there.
our stuff there, and then somebody said from the town, don't put any more stuff
Yeah, you're not supposed to be in the not that it matters.
No,
Not
I
that
know
it
it.
matters that it's dirty, I'm just saying you're
Yeah,
not
yeah.
supposed to be using the basement.
Yeah.
So that is our responsibility.
Yeah, the lease is,
Strictly up one level.
It's a pretty vague lease with the update and everything. It does lay out in terms that are a little bit contradictory, who's responsible for what, but you know, I think it's like number 5 right on the front page of the newest part of the lease. It says that, you know, the town is responsible for the outside, and you know, I don't know if remediation falls under cleaning, but it did sound like that was MVH's responsibility to me in reading through the lease, because this has been brought back.
Remediation is always the responsibility of the owner of the building. I mean, cleaning, of course, we clean our space, but remediation, if you look at the OSHA bulletin on mold, or, you know, it falls on the owner of the building to
I
do
think-
anything like that.
But again,
You're just going by the lease, right? What's
I am looking at the lease, and
what-
I'm just remembering that Dr. Prolansky is the administrator of MVHS, whose line is that our building is inadequate.
what's the lease dated? Do you know by chance?
It's up in 2026.
It's up in 2026. So this is all stuff that again we can look into and figure out ways to
Yeah.
better the communication, better the relationship,
Yeah.
get a prior list, and get things straightened out because we want healthcare here, and 2026 is right around the corner. So
And I do also think that, you know, it is important to have a great relationship with our healthcare provider. Our community is old. Our average age is nearly 70. We are more than 50% 60 and up. We're not young. And our winters are rough, and getting seniors to their healthcare facility is important. But one of the things I don't think that is going to help improve the relationship is to come into a forum with a lot of scolding language. I just think if the point is to improve the relationship, then maybe some of the conversation is ill-advised right now.
Thank you.
That's the point of having the conversation is.
Thank you, Linda.
The communication, I think.
You guys
I'm done.
Yeah, we're done.
I think that there was a lot of inaccuracy discussed over there, and that we just wanna put things back together.
I mean, until this particular thing, I thought the relationship was wonderful, to be honest. I didn't think there was any issues at all until the mold thing came up, and now all of a sudden we're,
Well,
But we're moving forward now, so
there wasn't anything prior to the mold issue.
we're moving
There was a lot
forward.
of
We kinda have to.
training that went on, which was.
2026, the lease is up. We kind of have no option
I'm
but
gonna
to
pull
move
the lease
forward.
out. I didn't think it was up in 26, but I'll pull it out and I'll give you all
We'll
a
find
copy.
out, yeah.
I'll give you all a copy. What?
29.
It's like 20
It's a few pages. I looked at it a little bit.
Rob, pull it out.
I
It's
looked,
in
yeah.
tiers.
yeah, no.
Oh, it's 6 years?
No, it goes in tiers and I don't remember, so I'm gonna pull it out because now I'm curious.
Thank
And I'll
you.
I
give
did
every-
scan it, but I'll
I'll give everyone a copy.
yes,
I will
that'd
do
be
that.
great. Thank you.
That's
Yeah, no,
easy.
yeah, I would definitely wanna read that.
That's easy.
Yeah.
But- Yeah, no. It's
Yeah,
getting
those
cleaned
guys.
up.
I like that priority list.
There they are.
Oh, thank you. Nothing else to do tomorrow.
Thank you.
Thanks.
We good?
Yeah.
Yeah, thanks, everybody.
Thank you for coming.